I am Dr. Shoibal Moitru. I am the adjunct professor and senior consultant in the Division of Allergy and Immunology at Apollo Multi-Speciality Hospital, Kolkata. Today I'll be talking on a very pertinent but overlooked problem, that is a drug allergy. You might have come across some incident like some patient goes for a surgery, gets an injection maybe of an anesthetic drug or maybe some antibiotic or maybe some pain relief medications, and the patient collapses and the patient then has to be taken to the ICU, and then many a times that patient has the stay gets prolonged, has to undergo lots of tests, treatment, and the patient is saved. But that is one of the experiences which no one would like to have. So this is how a condition of drug allergy usually it comes forward, and many a times we have seen that the patient takes one drugs, develop rashes all over the body, starts having a choking sensations, feels short of breath, and rushes to an emergency where they're given few injections, and then they comes out of that. So we need to understand that medicines, though they are used to treat a particular disease, any medicine in any form, they can actually elicit an allergic reaction. And to those who are not well versed with the concept of the drug allergy, it can really cause a lot of problems, and we have seen patients dying of the drug allergy also. So this is one of the problem which needs to be understood, which needs to be made aware not only to the patient but also the general populace and all the physicians as well. And we should also understand that how to tackle this problem. In the US, in the Europe, and in the other Western countries, as also in Australia, we know that drug allergy is much more, awareness is much more, and there the patient gets a medic alert bracelet, and where they usually wear that, and they usually labeled for a particular drug allergy, usually penicillin allergy, where we call penicillin labeling. And whenever the patient goes to any medical practitioner, usually he or she will ask about the drug allergy history, and accordingly the prescription is made. The awareness in India and also the data regarding the prevalences of the drug allergy is very low. So that is the reason patients usually goes on to any shop and they consumes the medicines over the counter, asks the pharmacist and tells them their problems, and the pharmacist gives them the medicines. So these are all the issues which are very important, and these are quite dangerous practices which needs to be stopped. So the drug allergy can be because of any drug, but the most common drugs that we encounter are the antibiotics. That is one. The next most common drug that we encounter which can cause the allergic reactions are the pain relief medications. Then the third common drugs that can cause allergy are the anesthetic drugs. Okay, so these are the common drugs which can cause the allergic reaction in a particular patient, but it depends upon an individual patient. It depends upon the individual scenario. So whenever in the family there is a history of the allergy and the patient has some or the other form of the allergy, and maybe patient has taken some antibiotics or some medications, and patient gets some rash or something, and patient feels a bit uncomfortable taking that antibiotics, so the patient should report that properly to a doctor. That is number one. Number two is that it is very important that everybody who has a mild reaction to a drug should note down the name of that drug in a diary, so that when the doctor asks them, they can provide a better information to the doctor. Because drug allergy evaluation very much depends upon what information the patient gives to the doctor. If the patient gives more better information, because here the doctor works like a detective. So detectives' work becomes easier if they provided with more and more information. They can identify the culprit drug, and then they can take necessary action, and they can then give the necessary advice. So this is very important to understand that what are the drugs which cause this. So history is very important. So a patient has to be well versed with what they are consuming. Even if they are taking some medicines over the counter, they should know that what is the name of the medicine. They may not know the exact composition, but they should know the name of the medicine. This is very important. Medicines are to be taken very seriously. Everybody should understand what they are taking. It's always better that they should not consume any medicine without the prescription of a physician. But if they're consuming anything, it's at least they should know the name of the medicine, so that any untoward event happens, they can actually relate that properly to that particular physician. The management that we all know, it is usually treated just like an emergency. We give epinephrine injections if there's anaphylaxis, or we can give any antihistamine tablets or the other medications. Evaluation usually needs a detailed workup where they need to visit actually a specialized unit head, and where the drug allergy evaluations are done. Patients have to undergo some series of tests, and depending upon the test results, usually a list is prepared where the doctor advises the patient can take these medicines and may not take these medicines. But again, that list is not exhaustive, because the drug allergy evaluation is a tedious process. So it is not that one comes and one goes to a doctor and says that, doctor, I want to do a drug allergy test. It's not like that. The drug allergy test is actually, this prescription should always come from a physician, from a general practitioner, from a pediatrician, from an ENT specialist, from any doctor who is giving the medicine to a particular patient, because that doctor knows that what are the drugs which this patient is usually can react to. So accordingly, the panel is chosen by the allergist. The allergist knows that what are the cross-reactive drugs, which drugs to use, which drugs not to use. Depending upon that, they choose the panel, and then they do the test. After the test, they again sit with the patient, discuss the issues, and they give a report. And depending upon the report, they say they should go and see the physician who has advised those tests. Usually it needs a collaboration between the allergist and the physician, so that these patients can be treated well. And if these patients need the drug, the most important thing is they need to avoid that drug. Usually the physicians give some other drug. But at times it happens that the patient has to take that particular drug to which the patient is showing allergy. So then we have a treatment option which is called the drug desensitization. So drug desensitization is an extremely specialized treatment, and that is not done anywhere except in our department in Apollo, where we do the drug desensitizations, and there actually the patients are given in tailored dosages of the drug in a supervised manner, so that they can tolerate that drug as long as they're consuming that drug. So after the drug is desensitized, the patient can take that drug immediately, complete the course, and then stop it. But it is a temporary process. It does not mean that once a drug is desensitized, it is for a lifelong. That is only for a short period, and within that short window period, patient can consume that drug, patient can complete the treatment, and after that again the patient has to avoid that particular drug. We have drug desensitization protocols for various drugs. They are international standardized protocols, but again for the many drugs we do not have protocols, which there needs to be prepared, which there needs to be individualized for a particular patient, and then it has to be evaluated. So all this requires a very strong collaboration between the allergist, between the physician, between the anesthetist. It's a team effort. So whenever you are having any issues related to drug allergies, any medicines, do not overlook it. Discuss it with your physician, discuss it with your treating doctor, whosoever is seeing you. And in any case, if you want a detailed evaluation, you can definitely come and see me. My numbers, my contact details are given. So then you can come to the department and we can do an evaluation in collaboration with the physician who is treating you, and then give you an advice which will actually prevent the causation of any severe catastrophic events because of some drugs in you, and make your life more safe. Thank you.